If you're pregnant and watching this, you probably know exactly what I'm talking about. That feeling when you just got comfortable, you're finally drifting off to sleep, and then boom, your bladder is like, nope, we need to go right now. And then you're lying there afterward, wondering if you'll be able to fall back asleep or if you'll be staring at the ceiling for the next 2 hours. Well, today I want to share something with you that might just change your nighttime routine for the better. We're going to talk about nuts. Yes, those little powerhouse snacks that you probably have sitting in your pantry right now, and how choosing the right ones can actually help reduce those midnight bathroom marathons, while choosing the wrong ones might be making things worse. Now, before we dive in, I want to be super clear about something. Frequent urination during pregnancy is completely normal, especially in your first and third trimesters. Your growing baby is literally pressing on your bladder, your body is producing more fluids, and your kidneys are working overtime. So we're not trying to eliminate nighttime trips entirely. That's just not realistic or even healthy. What we're focusing on is making smart nutritional choices that can help minimize unnecessary bladder irritation and support better fluid balance in your body. I've been researching this topic extensively, talking with nutritionists who specialize in pregnancy, and I've even experimented with these recommendations myself during my own pregnancy journey. The results have been, honestly, pretty amazing, and I can't wait to share what I've learned with you. So let's start with the good news. The 5 nuts that can actually help you get better sleep by supporting healthy urinary function during pregnancy. First up, we have almonds. And these are honestly like little nutritional gold mines for pregnant women. Almonds are packed with magnesium, which is incredible for muscle relaxation, including the muscles around your bladder. When these muscles can relax properly, you're less likely to experience that urgent, gotta-go-right-now feeling that jolts you awake. Magnesium also helps regulate fluid balance in your body, which means your kidneys don't have to work as hard filtering excess water while you're trying to sleep. Plus, almonds contain healthy fats and protein that help stabilize your blood sugar overnight, preventing those blood sugar dips that can trigger your kidneys to release more fluid. I like to have about 10 to 12 almonds as part of my evening snack, usually paired with a small piece of fruit. Next, we have walnuts. And these are particularly special because they're one of the few plant-based sources of omega-3 fatty acids. These healthy fats are anti-inflammatory, which means they can help reduce any inflammation in your urinary tract that might be contributing to increased urgency or frequency. Walnuts also contain melatonin naturally, which can help improve your overall sleep quality, making it easier to fall back asleep if you do need to get up. The protein and healthy fats in walnuts also help maintain steady blood sugar levels throughout the night. I usually have about 4 to 5 walnut halves in the evening, either on their own or chopped up in some Greek yogurt. Our third beneficial nut is the Brazil nut, and just 1 or 2 of these per day can make a significant difference. Brazil nuts are incredibly rich in selenium, which is a powerful antioxidant that supports healthy kidney function. When your kidneys are functioning optimally, they're better at concentrating your urine, which means you produce less volume overnight. Selenium also supports your immune system, which is important because urinary tract infections during pregnancy can cause increased urgency and frequency. Just be careful with Brazil nuts. They're so high in selenium that you really shouldn't have more than 2 per day, or you could get actually too much selenium, which isn't good either. Fourth on our helpful list are hazelnuts, which are loaded with vitamin E and healthy monounsaturated fats. Vitamin E acts as an antioxidant that helps protect your urinary tract from oxidative stress, while the healthy fats help maintain the integrity of cell membranes throughout your urinary system. Hazelnuts also contain folate, which is crucial during pregnancy anyway, and they provide a good amount of fiber, which helps with overall digestive health. When your digestive system is working smoothly, there's less pressure on your bladder from intestinal issues. I love adding chopped hazelnuts to my oatmeal or having about 8 to 10 as an afternoon snack. Finally, we have pecans, which are fantastic for supporting healthy fluid balance. Pecans contain a good amount of potassium, which works with sodium in your body to regulate fluid levels. When your electrolyte balance is optimal, your body doesn't retain excess water, which means less pressure on your bladder. Pecans also provide magnesium, zinc, and healthy fats that support overall urinary tract health. The fiber in pecans helps with digestion, and they have a relatively low glycemic impact, which helps maintain steady blood sugar levels overnight. Now, here's where things get important. Timing matters with these nuts. I recommend having your serving of beneficial nuts about 2 to 3 hours before bedtime, not right before you lie down. This gives your body time to process them properly and absorb all those helpful nutrients without adding extra work for your digestive system when you're trying to sleep. But now we need to talk about the flip side, the 5 nuts that you might want to avoid or limit during pregnancy, especially in the evening if nighttime urination is a problem for you. First on the avoid list are salted or flavored nuts of any kind. I know, those honey-roasted peanuts or those garlic-flavored cashews are so tempting. But here's the thing. The high sodium content in these flavored nuts can cause your body to retain water during the day, and then when you lie down at night, all that excess fluid starts getting processed by your kidneys. This leads to increased urine production right when you're trying to sleep. Salt also makes you thirsty, so you end up drinking more fluids later in the day, which compounds the problem. If you're going to have nuts, always choose raw or dry roasted varieties without added salt or flavoring.
Third, and this is a big one, any nuts that you're eating too close to bedtime, regardless of the type. Even the beneficial nuts I mentioned earlier can become problematic if you're eating them within 2 hours of lying down. Your digestive system needs time to process the fats and proteins in nuts, and if you eat them too late, your body will be working on digestion when it should be winding down for sleep. This can lead to increased metabolism, more fluid production, and ultimately more trips to the bathroom. Fourth, we need to discuss macadamia nuts. While these are delicious and generally healthy, they're extremely high in fat, even higher than other nuts. This high fat content can be harder for your body to process, especially during pregnancy when digestion is often slower anyway. When your digestive system is working overtime to break down high-fat foods, it can cause bloating and put pressure on your bladder. Additionally, the high calorie density of macadamia nuts means it's easy to overeat them, which compounds all these issues. Finally, any rancid or stale nuts should definitely be avoided. When nuts go bad, they can cause digestive upset, inflammation, and even mild food poisoning symptoms. During pregnancy, your immune system is already working harder and your digestive system is more sensitive. Eating rancid nuts can cause nausea, stomach upset, and increased fluid loss that your kidneys then have to work to replace, leading to more frequent urination. Always store your nuts properly in airtight containers, check expiration dates, and trust your nose. If they smell off, throw them out. Now, let me share some practical tips for incorporating this knowledge into your daily routine. First, think of nuts as part of your overall fluid management strategy. If you're having your beneficial nuts in the late afternoon or early evening, pair them with a small amount of fluid, maybe some herbal tea or just a small glass of water. Don't avoid fluids entirely because you need to stay hydrated during pregnancy, but be strategic about timing. Second, pay attention to portion sizes. Even with the beneficial nuts, more isn't always better. A small handful, which is usually about an ounce or roughly what fits in your cupped palm, is typically the right amount. This gives you all the nutritional benefits without overloading your digestive system. Third, consider keeping a simple food and sleep diary for a week or two. Note what nuts you eat, when you eat them, and how your nighttime bathroom trips change. Everyone's body is different, and what works perfectly for one person might not work exactly the same way for another woman. Some women find that even the beneficial nuts need to be eaten earlier in the day to avoid any impact on nighttime urination. Also, remember that hydration timing matters just as much as nut timing. Try to do most of your fluid intake earlier in the day and taper off about 2 hours before bedtime. When you do drink fluids in the evening, sip slowly rather than drinking large amounts at once. I also want to mention that if you're experiencing sudden changes in urination patterns, burning sensation, blood in your urine, or severe urgency that's different from your normal pregnancy symptoms, please contact your healthcare provider right away. These could be signs of a urinary tract infection, which is more common during pregnancy and needs medical treatment. One more thing that's been really helpful for me and many other moms I've talked to is creating an evening routine that incorporates these nutritional strategies along with other sleep hygiene practices. Maybe you have your small serving of almonds and walnuts with some chamomile tea around 6 or 7 p.m. Then you do some gentle stretching, take a warm shower, and avoid screens for the last hour before bed. This kind of comprehensive approach tends to work better than just changing one thing in isolation. Before we wrap up, I want to remind you that every pregnancy is unique, and what I'm sharing here is general nutritional information, not medical advice. Always check with your healthcare provider before making significant changes to your diet during pregnancy, especially if you have any existing health conditions or concerns. Also, remember to be patient with yourself as you try these strategies. It might take a week or two to notice changes, and some nights will still be better than others. Pregnancy is such a journey, and getting good sleep can feel like an impossible challenge sometimes, but every small improvement helps. I really hope this information helps you get some better rest during your pregnancy. If you try any of these nut strategies, I'd love to hear about your experience in the comments below. And if you found this helpful, please give it a thumbs up and subscribe for more pregnancy and parenting content. Thanks so much for watching, and I'll see you in the next video. Sweet dreams, Mama.